Gastroscopy. A gastroscopy is a test that allows us to look directly at the lining of your gullet, stomach and the first part of your small intestine, duodenum. The gastroscope is a long flexible tube, thinner than your index finger, with a bright light at the end. It is passed through your mouth. What are the benefits of having a gastroscopy? This test allows us to see, diagnose or treat most problems immediately. We can take biopsies or give medication via the scope if necessary. If you have a narrowing in your esophagus, we may be able to stretch this using a small balloon. This may be uncomfortable. Getting ready for the procedure. If you are taking warfarin, clopidogrel or any other blood-thinning drugs, except aspirin, please contact us for advice. If you are taking diabetic medication or insulin, please contact us for advice. Please take all other prescribed medications as usual unless specifically advised not to. If you answer yes to either of the following questions, please contact us for advice. Have you ever been notified that you are at an increased risk of CJD or VCJD for public health purposes? Have you received multiple 50 units or, on more than 20 occasions, transfusions of blood or blood products since 1980? Please have nothing to eat for 6 hours before your appointment time. You may drink water up to 2 hours before your appointment time. You may be in the endoscopy unit for 3 hours. However, sometimes we may have to attend emergencies, which must take priority and therefore your wait may be longer. Please note your appointment time is for arrival in the department and not the time of your procedure. Can I have sedation for the procedure? Yes, but you must have someone to collect you from the unit and stay with you for 24 hours. Sedation is a relaxant, not a general anaesthetic. What are the risks and consequences? Most gastroscopies are straightforward, but you may have a sore throat or suffer from a little wind in your stomach, but this will quickly settle. Very rare complications, less than 1 in 1,000 procedures, include reaction to medication or bleeding. A much rarer complication is perforation, making a small tear in the lining of the gullet, stomach or duodenum, which would require you to stay in hospital and in some cases may need an operation. Please be assured that these complications are extremely rare. It is important, however, that you seek medical advice from your GP if you experience any of the following symptoms after your procedure: severe pain in your chest or stomach, pass black tarry stools, vomit dark brown or bright red blood. If you are concerned about any of these risks or have any questions, please speak to a health professional on the day. Alternative treatments. Your consultant has recommended this procedure as being the best option. However, sometimes a barium swallow or barium meal may be performed instead. However, treatments cannot be undertaken during these procedures. Therefore, you may have to undergo a gastroscopy at a later date. What should I expect? On the arrival at the endoscopy unit, the receptionist will check your details. A nurse will then ask you a number of general health questions. A nurse or doctor will explain the procedure and ask you to sign a consent form. If you have any questions or worries at this point, please raise them. It is important that you are as relaxed as possible for the procedure. Your throat will be sprayed with a local anaesthetic, and if you have chosen to have sedation, a small plastic tube will be inserted into a suitable vein. You will then be made comfortable lying on your left side. A mouth guard will be placed between your teeth, or gums if you have dentures, as these will need to be removed. The mouth guard is used to keep your mouth slightly open and to prevent the tube from being bitten. The nurse or doctor will pass the tube over the tongue to the back of your throat and may ask you to swallow. Once the scope is in the esophagus, air will be passed through to swell the esophagus, stomach and duodenum to enable us to have a clear view. This can sometimes be uncomfortable. The procedure should only take a few minutes and a nurse will be with you throughout. You will need to remain in the department for a short time following the procedure. When do I get the results? A nurse will usually give you the results before you leave the unit. However, if you have had biopsies taken, these have to go to the laboratory for examination. This will take up to 2 weeks and the results will be sent to your GP. Discharge information and at-home advice. If you have had a sedation, this will remain in your body for 24 hours and during this time it will be gradually excreted. For the first 24 hours after your procedure, you should ensure that a responsible adult stays at home with you for 24 hours. Rest quietly at home for the rest of the day. Go to bed or lie on the settee. Drink plenty of fluids, but not too much tea or coffee. Eat a light diet, e.g. soup or sandwiches. Avoid greasy or heavy food, as this may cause you to feel sick. Lie flat if you feel faint or dizzy. Contact your GP if you have not passed urine within 12 hours after your procedure. There are certain things you should not do. Drive. Your insurance company may refuse to meet any claims if they feel you have driven too soon. Go back to work. Operate any domestic appliances or machinery. Drink alcohol. Make any important decisions or sign important documents. Be responsible for small children. If you have any queries regarding your appointment or about your test, please contact the endoscopy unit.